I'm Stephanie, and I'm a registered nurse at the New Jersey Eye Center. And on behalf of the New Jersey Eye Center and Dr. Joseph Dello Russo, I'd like to welcome you to the first live webcast of Down-Up Flying Spot LASIK using the Later Vision system, and performed here by Dr. Joseph Dello Russo of the New Jersey Eye Center. But first, I'd like you to meet Dr. Joseph Dello Russo.
Thank you, Stephanie. Welcome to the New Jersey Eye Center, and soon we will be performing live LASIK surgery. First, let me try to explain in simple terms, what is LASIK? LASIK is a surgical procedure whereby we use a laser beam to change the shape of the cornea so as to eliminate the need for glasses or contact lenses. It takes place in two steps. The first step, we use an instrument to pull up a layer of the cornea, like that, raised layer of the cornea. Then we use a laser here to reshape the cornea. We replace the flap, it assumes the new shape of the cornea, and we've eliminated the need for glasses.
Dr. Dello Russo, how is the technique that you're demonstrating today different from the early techniques that you pioneered in the early 1990s?
Well, Stephanie, it's very different. In fact, there's two very important differences between the way I do LASIK and the way other doctors do LASIK. I call my procedure down-up flying spot. The down-up refers to the direction in which the flap is made. Traditionally, we've made the flap from side to side. I never like that. The way I make it is from down up, so that when we replace the flap, it's kept in position by the natural blinking of the eye. The second way it differs is that I use now what is known as the flying spot LASIK. Now, flying spot refers to a whole new generation of laser technology. In the past, the laser that we introduced 10 years ago, we applied a single column of light onto the cornea. And that sometimes left some little ridges, which wasn't desirable. With the flying spot laser, we use a very tiny beam of light that literally flies over the cornea of the eye, reshaping it, and the end result is a very smooth surface, which is very desirable for good vision, good return of vision, and for no pain, basically.
What everybody watching wants to know, is this laser eye surgery right for me?
Well, Stephanie, about 99% of people who wear glasses for distance are theoretically candidates. But in actuality, not all 99% are candidates. And a very important part of what we do here at the New Jersey Eye Center is to perform extensive examinations to separate those people who are not candidates from people who are candidates. We only treat people who are good candidates. We put them through, beside a comprehensive eye examination, we put them through corneal maps, pachymetry, the measuring the thickness of the cornea, microscopic examination, look at diseases of the eye, a whole series of tests. And we find that every day we turn away about 6 patients who really aren't good candidates for it. But anyone who we do treat are good candidates. I'd like you to meet today, our patient for today, Sophia.
I can't see far away. I'm nearsighted, and I have a problem. I've been wearing glasses for 20 years, and not a fun thing. And I know a lot of people who've come to Dr. Dello Russo have had the eye surgery, and I've seen them the next day at school, picking up their kids. So I looked into it, and I'm very excited.
The beginning of Sophia's examination starts with some preliminary tests. The one she's undergoing right now is our basic test to determine, it's to measure the what we call the refractive error, that is her amount of nearsightedness or astigmatism that she may have. There'll be other tests to be done. She'll have a glaucoma test done, have a vision tested without glasses, and then we'll take her to other rooms where we're going to perform some other tests.
Right here. I'm going to have Dr. Dello Russo is going to come in a few minutes and going to examine you. Okay?
This particular test is called corneal topography, or mapping of the natural contours of the eye. It's particularly important for us prior to surgery, basically to rule out diseased corneas. corneas that are misshapen. And that's what we're going to be doing right now. Michael's going to be doing this test on each eye.
Good. Perfect.
To have the surgery, your eyes have to be totally healthy, right? Now we know that from the maps that we used before, that we measured before, that your eyes have a normal shape. We have to make sure that your eyes are very healthy this way here. Your cornea looks very nice and healthy. Your lids look good. The white part of your eye looks fine. Okay, no disease. Your eyes are very healthy. Sophia, so as a result of all these examinations, I can tell you that you're an excellent candidate for the procedure. I think we should speak about, before we go to the surgery, is this surgery risk-free? No, it's not risk-free. And like everything else, nothing is 100%. And we do know that there are certain risks, but in actuality, the risks are diminished a great deal by the experience of the surgeon, as well as his team, and the highest of technology that he may be applying. For example, we think, for example, that contact lenses are risk-free, right? Well, anybody's ever